Let's start our webinar. Welcome to all of you. My name is Rae Thomas. I am the Research Education Lead for the Tropical Australian Academic Health Centre, and I sit here in Townsville. Today, we're going to do two things. The first thing I'm going to do is orient you to a systematic review and look at how to critically appraise a systematic review in a pragmatic way. The next thing we're actually going to do is look at how to interpret a forest plot in that space. So just again, orient you to a forest plot and what are the important kind of components of a forest plot that you need to look at to actually be able to interpret that. Now, because there's quite a few of us today, I'm afraid this is going to be quite the lecture, and we'll leave Q&A until the end. I apologise for that. But we're going to work out that, and I'll leave some space so that you can ask your questions. So if you have any questions, please feel free to write them down. Because I'm presenting for the full hour, I won't be able to monitor the chat. So make sure that you write them down somewhere so that you can remember to ask me at the end. Before we start, I would like to acknowledge the traditional custodians of the land on which we all gather. For us here in Townsville, it is the Walgotakava and Bindles people, and I pay my respects to their elders past and present. So that we have an idea about where you're all from, it would be great if you could put in the chat for us, what organisation are you affiliated with predominantly? And that'll help us understand who actually is in the room, and we'll gather that information for you. Thank you very much for the start. All right. So for those of you new to any TARC webinars, the Tropical Australian Academic Health Centre is a collaboration between the 5 Northern Queensland HHSs. I'm sorry, I'm reading the chat now. I'm losing my track. The Northern Queensland PHN, the Queensland Aboriginal and Islander Health Council, and James Cook University. We have specific research themes that are relevant to Northern Queensland, and you can see them on the slide. What I'd like you to take away from today too, if you are interested in the working that we're doing from TARC, there is our website that you'll be able to access and have a look at all the things that we do. This webinar is recorded and it will be available on the TARC YouTube site when we're finished, probably in about a day or two. So just for housekeeping, it's great to see you all here. Thank you very much for keeping your mics off just while we're doing the talk. Please, at the Q&A, I would love to see your faces. It's really tricky to sort of talk to people who I can only see initials for. So feel free to ask questions in the Q&A and we'll work on that structure. But at the moment, it's great. Mics off. That's really helpful. Thank you very much. All right. So let's get going about systematic reviews. All right. So systematic reviews are the highest level of evidence in health research. Okay. And they follow very, very specific rules. Okay. They ask very focused research questions, right? They include studies that are pre-specified in their criteria. We know what we want to include when we're asking these research questions. It has quite systematic and particular rules about the searching techniques that you would use when you're doing a systematic review. And there are ways that you want to synthesize and organize the data from your systematic review. So just to let you know, when we're talking about systematic reviews being the highest level of evidence in health research, we're actually, of course, talking about there are broad questions in health research. There are several different types of questions. And, of course, then a systematic review of the highest level of primary evidence is in fact the highest level of evidence. So you've got different systematic reviews for different health research questions. For example, up the top left, we've got an intervention systematic review. Underneath that is a prognostic systematic review. Across to the right, we've got a diagnostic systematic review, and underneath that is an experiential qualitative systematic review. So you can do systematic reviews for all of the different types of health research questions, but you must match those systematic reviews to the primary studies that are best relevant for your research question. But why on earth would we want to appraise a systematic review, right? Well, it might come to a surprise to you, those who aren't researchers, but just because it's published doesn't actually mean that it's any good whatsoever. right? So poor systematic reviews, if they're not done well, they can actually produce misleading kind of information. And when you think about, as clinicians, you often use clinical practice guidelines, right? What if your clinical practice guidelines are based on evidence that's really poorly done, right? That could actually have really severe consequences to the patients that you're teaching. So what we have to do when we're thinking about our patients, when we're thinking about conducting a systematic review or appraising a systematic review, we actually have to think about the kind of systematic review, how it was done, and what are the studies that have been included in that systematic review. You need to think critically about reading all research, okay? And this one is just about how to critically appraise a systematic review. So there are a couple of different types of ways that you can critically appraise systematic reviews. There's something called the AMSTAR. Now, the AMSTAR is the gold standard of appraisal for systematic reviews. It stands for, and it's not intuitive, it stands for a measurement tool to assess systematic reviews. So that's the AMSTAR gold standard for assessing systematic reviews. But there are other more pragmatic tools that assess lots of different types of research. And there's a website that has what called the CASP tools, and that has a lot of different critical appraisal tools in there that are really helpful for clinicians, using lots of different research questions that will help you appraise studies quickly. What we're going to focus on today is a very pragmatic appraisal tool for systematic reviews called FAITH. And FAITH was written by the Centre for Evidence-Based Medicine at Oxford University. And we're going to focus on that one today because it's fast and it's easy to remember. It's easy to remember because it's FAITH, right? So FAITH stands for finding the studies, appraising the studies, including the good ones, totaling the studies up properly, and then having heterogeneity. Now, somebody can't hear me properly. Is everybody else okay? I can only see Doris. Doris, can you thumbs up? You right? Okay, it looks like it's not me. Okay, cool. All right. So FAITH is a really simple way to think about the components of appraising a systematic review. All right. So what does that look like? Today, we're going to talk about 3 different things when we're thinking about FAITH. The first thing we're going to look at is about what do you need to consider when you're critically appraising each of those letters in that acronym FAITH. What do you need to think about? What is it that we're actually looking for? Then it's, where do I find it? Right? So the biggest thing I want you to take away from today is, when you're critically appraising someone, don't actually read the whole article, right? Don't, right? Critical appraisal means I'm going to point you to where I want you to read for particular sections. And then if you think it's a good article, by all means, go in and then read the whole thing and understand it better. But to critically appraise, do not read the whole paper. So in this talk, I'm going to talk about, where do you find the information, or where's best to look? And then I'm going to orient you towards, okay, well, what are the clues that you might need to look for when we're talking about all of those? So let's start with our first letter in FAITH, F. And F stands for, did the search find all the relevant evidence? So what we want to look for, what we're interested in knowing now, is what kind of databases did the researchers search in their systematic review? Did they look at the reference list of the included studies? Were all languages included or not? And that's really hard for researchers, right? Because we assume that, because I only speak English, I can only appraise or include English articles. But there might be some really important studies that are not written in English, or that are written, that you should be including and you need to consider about including. So sometimes in universities, we're really lucky that we have student cohorts. And so what I've done in the past in systematic reviews is I've actually put an email out to student cohorts saying, does anybody speak this language, and this language? If you do, give me a heads up. I'll pay you in chocolate, right? So then people can come and I can orient them and I can ask them about articles that I'm interested in. What are the search terms that they might have used? That's what I want to know. And were experts potentially contacted? Where do I find the information for find? I will mostly find it in the methods and the results section, right? So you'll be clear that when we're looking at critical appraisal, I'm not even reading the introduction, right? Not looking at the introduction. I'll barely glance at the abstract, just check to see if it matches my needs. No introduction required, no discussion required. Most of this stuff is going to be methods and results. And the things that I'm looking for, kind of the clues that I want to know about finding the right articles, are things like the databases. What are the electronic databases that are relevant for this question? Where did they search? What have they done with the reference list? Have they hand searched the reference list of the included studies? Did they use mesh terms, keywords? Were experts in the field contacted? All those clues are something that I'm particularly interested in reading. If I go to appraise, right, the A in the FAITH acronym, what I'm interested in doing is finding out, was the quality of the included studies assessed? All right. And where am I going to find that? Mostly I'm going to find that in the methods section. There might be some clues in the results section, but they should have told me that in actually the methods section. Are they appraising the studies that they've included? And the things that I'm looking for, the clues, are language like wrapped around risk of bias, or CASP, or any of the quality appraisal tools, Cochrane Risk of Bias tool, for example. All of those things will help me understand whether or not they've critically appraised the included studies in their papers. And the reason for that is that you want to make sure that you're including the good studies, right? And we'll come to that when we come to I, which is next, right? So if you've appraised the studies that you've included, what'd you do with them? Right? So what I want to know is, did they only include the high quality studies, right? If you've appraised it, and you should, right? What did they do with that critical? They appraised it and then they just shoved anything in it whatsoever? Or what did they do with the high quality studies? What types of studies were included in the synthesis, and what quality were those studies? Where will I find this information? I will find that in the results section mostly. Right? And what am I looking for? I'm looking for things like languages wrapped around high quality studies only included. Sometimes what you can do when you include lots of different studies is you might do sensitivity analysis, is another phrase that you'd be looking for. Or you'd be looking for, we only included randomized controlled trials or things like that relevant to the research question. But what are kind of the things that they've talked about that tell you they've actually thought about what to do with the high quality studies versus the low quality studies that they've appraised? So the T in the FAITH acronym stands for total, right? Have the results been totaled up appropriately? Right? What I want to know about there is, have they done summary tables, right? Table 1 of a systematic review should be your included studies. Have they told me about what they are? In the results section, had they summarized the results potentially in a table? Or in this particular study that we're going to talk about today, because it's also about forest plots, they've summarized it in a forest plot, right? Where am I going to find this information? Mostly I'm going to find it in the results, but they should probably flag it to me in the methods section. High impact journals will have sections called data analysis, which they should tell me about how they've constructed this. And they're going to talk to me about that, and then I'm going to find it in the results. What am I looking for particularly? There should be a table 1, which is your included studies. There's going to be a potential table 2 that actually is in your results section that tells me what the results are, or there's going to be a figure that shows me what those summary results are. And then we come to the variability of the intervention effects of the included studies. Now that's called heterogeneity, right? So what that means is that when they've summarized, a systematic review is about synthesizing different studies. And when they have summarized the results of those studies, have they thought about the variability in the intervention effects in those studies? Because even though studies appear to potentially measure the same outcomes, all right, it's actually how the studies were conducted that really influences the results, right? Because not all studies are created equal. So what we want to do is make sure when we're looking about variabilities, we want to compare apples with apples. So we want to check that they've considered what's the variability of the intervention effects within the studies that they've included. I'm going to find that mostly in the results section, but they should have again flagged that to me in the methods section as well. What am I looking for? Things like forest plots. Have they considered I-square heterogeneity statistics? Have they talked about the discussion of the quality of the papers? Have they synthesized it in a way that shows me that, oh, here are the good quality studies. These are the ones that we think are similar in risk of bias content compared with others. All right. So let's have a go, right, shall we? Let's pretend that you are a locum GP and you're in a remote northern Queensland town. You've met an adolescent who has complex psychological needs, right? And you know that they need psychotherapy, but you're in a remote town and there isn't a psychologist on hand that's going to do that. So what you think they might need is some telehealth psychotherapy, but you don't know. You don't know, is telehealth psychotherapy for some complex needs better or the same as face-to-face psychotherapy? So you have this kid and you want to make sure that this kid gets the help that he or she needs. All right, so let's go and have a look. As a clinician, you're going to go and have a look on your databases and try and answer your clinical question. What's best for this child here? Ooh, what a surprise. I found a systematic review that is about telehealth versus face-to-face psychotherapy for less common mental health conditions. It's a systematic review. They've also conducted what's called a meta-analysis, and they've done it of randomized controlled trials. So a couple of things here make me think that this might be a good one, right? So it is a systematic review, and it is an intervention question, right? Because they want to know, does one intervention work better than another intervention? So they're going to have to include studies that are the best study designs for intervention questions. And the best study design for intervention questions are randomized controlled trials. So they've included the best kind of primary study designs. It's a systematic review. And the way they've synthesized it is by doing a meta-analysis. And the second part of today's talk is about interpreting forest plots, which is the diagram that's usually presented along with meta-analyses. So, okay, we found it, right? But now what we want to know is it actually a good study or not? So we have to critically appraise it, and we're going to critically appraise it according to faith. Find. Did they find all the relevant evidence? All right. What we're looking for is we're going to go to the methods section and the results section only, and we're looking for things like PubMed, Embase, Cochrane Central Language, mesh terms. What were their search structures looking like? Were there experts in the field consulted, right? So they're the kind of things that we're looking for, and we're going to find them in the methods section mostly, potentially in the results. So let's see what this study actually did. So on the left-hand side, I have quotes from the study, and on the right-hand side, I have my interpretation according to faith. So if I'm looking at find, did they find the studies? Okay, on the right-hand side, they searched 3 bibliographic databases, right? And I can tell that because they have a lovely heading for me called Database Search for Primary Studies, and they've told me they've searched PubMed, Embase, and Central from the Cochrane Library. They're good ones, right? In systematic reviews, you must search 3 or more, right? So they've searched some good ones. They could have used PsycInfo, but they're probably not going to use Scopus because Scopus isn't for psychological interventions, right? So you've got to think about what are the bibliographic databases that possibly are the most relevant for these kind of questions. All right. Then further down in that section, they've also told me that they've included concepts in their search strategy. They've included telemedicine, and they've used the Boolean operator and primary healthcare and face-to-face and randomized. And they conducted a backward cited and a forward citing analysis. So what they did was they checked the references of any included studies, and they went backwards and searched for studies, and then they searched forwards for any studies that cited the included studies. So that's really comprehensive. They've searched a couple of databases, they've gone to their included studies, and they've done backwards and forward citation searching. They gave me the date of the search. Now, if you're ever doing a systematic review and you want it published, and you as a clinician got busy and your search was like 2 years ago, they're going to say update your search, right? So your search can't be a year out of date. I told you systematic reviews have rules, right? So your search needs to be within a year, okay? So they gave me the search, it's within the publication, and that's fine. They also told me they had no restrictions on language or time. Time is important because in this case, it's not important. They didn't worry about time because they just wanted psychotherapy. But what if you were looking at an intervention that was only invented 5 years ago? There's no point searching the databases from inception to now because the intervention didn't exist until 5 years ago. So think about time and think about what you want that to look like, because there might be some good reasons for restricting the time on your search. One could argue about language, as I have before. Super importantly, they've actually given me their search strategy, right? In their appendix, they've actually given me their PubMed search strategy. Okay, so I would be able to replicate their search quite easy. The other thing I found when I was looking through their paper is that in their results section, they gave me this. And this is called a Prisma flow chart. And usually in systematic reviews, this is going to be your figure 1. And this shows me all of the process about all the studies that they've got from when they search different databases to their included. So you can see down the end that they've included some studies in qualitative synthesis. They've got 12 studies using 14 references. And at the bottom, you can see in the quantitative synthesis, in the meta-analysis, they've included 9 studies with 11 references. But you can see that they started off with around about 7,000 to screen. Okay? So that was in the results section. So for find, if I was thinking about appraising this and whether or not yes, no, or unclear, which are the categories for appraisal in a face questionnaire, I go, yeah, I think they found what they needed to find. I think that's pretty good. So I would tick yes for this. We get to appraise, right? So, okay, so how did we appraise? Where are we going to look at that? Did they appraise the study of did they appraise the included studies in their systematic review, right? I'm going to find that. They're going to tell me about it in the methods section. They might sneak me some information in their results section as well to have a look at, but they should tell me about it in their methods section. I'm looking for things like risk of bias, Cochrane risk of bias tools, CASP tools, all of those things we talked about before. So what can I find? All right. In this study, in the methods section, they've told me a couple of things. They've said that 2 review authors, and they've given the initials of the authorships, so I know exactly which 2, independently assess the risk of bias of the included studies using the Cochrane Collaboration Risk of Bias tool. Right? I know they did it, right? They also told me the kind of domains that were assessed in the Cochrane Risk of Bias tool, and they told me what the grading was, low, high, or unclear. They also showed me in figure 2, they showed me a risk of bias graph. So this was be in the results section, all right? And this gives the risk of bias. This is a summary of all the studies that they included in their systematic review, and it shows me how many. The green is low risk of bias, yellow is unclear risk of bias, and red is high risk of bias for the domains that they assessed, which is down the left-hand side of this diagram. So for me, in terms of faith and appraise, did they appraise the articles in their systematic review? Yes, they did. And they told me how, and they told me how it was scored. So that's a yes from me on appraisal. Faith, we're talking about include now. So did they include only high quality studies? They've assessed them, they've done something with them. Now I want to know, what did they do in the results section with these included studies? So Most of this I'm going to find in the results section, all right? There might be a little bit in the method section, particularly for high impact journals. They might have a data synthesis section or a data analysis section. Mostly it'll be in the results section. What am I looking for? I'm looking for some statements that talk about high quality studies were included, or sensitivity analysis was conducted with high quality studies and low quality studies. So I'm going to look at, now they've appraised it, how did they use that appraisal to inform the results of their systematic review? So let's have a look what this guys did. All right. So these guys told me two different things. First, in the methods section, there was a header called data synthesis and analysis. And in that section, I found that they said, look, we plan to conduct a subgroup analysis of gender, setting, age, and sensitivity by including or excluding studies of high risk of bias. But they couldn't, because they didn't have enough studies to do this. So they've told me what they wanted to do, but they've also told me that they couldn't because of why they couldn't. And they're right. They can't actually do sensitivity analysis when there's not enough studies in order to subtract or add to those analyses. So what they did instead, and we'll have a look about later, in their forest plot, they gave me the risk of bias for all the studies they included in their forest plot, so I could see what the risk of bias was like in that particular study. So they wanted to include only high quality studies, but they couldn't because there wasn't enough. So instead, they went, here, we'll show you what the risk of bias was for each study, and you can make up your mind. So for include, okay, did they include the studies? Did they think about that? It's a yes from me. They did good there. So what I want to know now is, how did they synthesize this? What did they do, right? Just because you do a systematic review doesn't mean you do a meta-analysis. You often see those two things together, but they're not together. You can do a systematic review without a meta-analysis, right? So what I want to know in systematic reviews is, how did they tally up the results, right? So this is going to be in the results section, or potentially again in that data analysis section in the methods if there is one. And I'm looking for a figure or a table that summarizes that and shows me quite clearly how they tallied that up. So what did these guys do? Again, in their data synthesis and analysis section, I found that they said they conducted meta-analyses and created forest plots to calculate treatment effects. They performed meta-analyses only when they could. That means there had to be more than 2 studies that compare the same or similar outcomes, and where appropriate data was available. And when they were not available, when they couldn't compare it numerically in a meta-analysis, they told me that they narratively summarized the results. So that's pretty comprehensive, right? They told me that they did it numerically when they could and narratively when they could not. Again, what I also saw, which we're going to unpack in a minute, is the forest plot. So they showed me quite clearly how they constructed their forest plot and what that means. So in terms of total, and did they do a good job with their totaling? Again, I think they did. And finally, we come to the heterogeneity, right? So, okay, so the studies that are variable, how variable are they? What does that look like? And have they considered that studies are different, particularly in psychology? Psychology has lots of variability and heterogeneity. Well, they have a lot of heterogeneity, is fair to say. Where am I going to find this? Mostly I'm going to find it in the results section, right? And what am I looking for? If they do a forest plot, then automatically, usually, you have things called the I-squared statistics that's done in the forest plot. But I also want to see about it in the results section. I want to see them discussing things like quality and what that looks like there. All right, so what do these guys do? Right, again, they flagged it in the methods section. The top bit said we anticipated considerable heterogeneity between studies, and so therefore they used a meta-analytic approach called a random effects model. I don't expect you to understand that. That's fine. But they did, right? They then also told me that they did use that thing called the I-squared statistic to examine heterogeneity, and they also conducted subgroup analysis according to the duration of follow-up. right? The next bit is in the results section. So they said that the primary outcome that they were looking for was global or symptom severity. And they told me in there, in the results section, they gave a clear description of there was moderate heterogeneity in the 6-month follow-up group for symptom severity, right? So they told me they were going to do it. They told me also in the results section using words that they have done it. And then they've showed me in the forest plot that they've done it. So in the forest plot, these pink bits here, you'll see are the I-squared statistics. And you'll see that there are a couple of zeros, which mean, nah, we're all good. Everything's fine here. But the last one at 6 months is 43%. And that's what they told you back here. Let me just go back. Moderate heterogeneity, 43% in the 6-month follow-up. And they've doubled that, and they've shown you that in the forest plot as well, right? So pretty much not hiding anything here. So for the last faith letter, H, in the heterogeneity, I'm also going, yep, that was a good one too. So I'm feeling like that's okay. All right. Before we travel then, are you okay that this systematic review seems to be, the critical appraisal seems to be fine. All of the faith acronyms were ticked, the letters were ticked. We have found, appraised, included, totaled, and we looked at heterogeneity. So all of those are good to go. Only now would you look at the results of a systematic review. Do you have any questions about faith for me before I then delve into the second part, which is interpreting the forest plot with you? Any questions? Put your hand up. I can now monitor hands. None? Must have been super clear then. I feel like I probably wasn't. All right. I'll keep going, but I will expect questions about the next bit. All right. So now we're going to interpret what does it look like. Okay. So this is what they chose to do in this systematic review was a meta-analysis, and they depicted the results in a forest plot. This is how we're going to interpret the forest plot. So I'm going to orient you to the different sections of the forest plot. All right. So this is a forest plot of their primary outcome, the first outcome that they are interested in. It is a lot to take in, but it's recorded. So that's all right. So this is a forest plot of their primary outcome, right? And their primary outcome is telehealth face-to-face for medical conditions, assessment of symptom severity. Okay, so let's walk through what are the components of this forest plot. Okay, so the first things we're going to talk about is the time here. So these circle bits here, you can see immediately after treatment, 3 to 4 months after treatment, 6 months after treatment, and 12 months after treatment. So this is all about symptom severity at those follow-up time points. Okay, that's the first thing, time. What is the forest plot divided into? Over here in these brackets, these things here, they are all of the included studies that looked at severity, symptom severity immediately after treatment. So all of those studies contributed to the answer about symptom severity immediately after treatment. Here, these columns here tell you this is about the telehealth intervention, and this one is about the face-to-face intervention. Okay, so that's the first orientation. Okay, what are we looking at? All right. Now, when we're looking at telehealth and face-to-face, you'll notice that they've talked about it in means, right? So they've got 2 groups. Each one of those studies, Burgess, Comer, Day, Himley, McAndrew, Watson, and G, all had 2 groups, right? And they assess symptom severity at different time points. And this time point is immediately after treatment. And immediately after treatment, Burgess's mean here is 7.55. Right? So we're talking about means. All right. And their mean face-to-face immediately after treatment was 7.41. Right? We're talking about means. Over here, and this bit here shows you graphically what that looks like. Right? So over here is the standardized mean difference, and that's what it talks about when you're looking at how a meta-analysis pools all these results together, and it's called a standardized mean difference. As an aside, what you can see over here is that risk of bias that we talked about in our appraisal, right? So I can see that Burgess, this first one here, was really good on domain A, and I'd have to go back and have a look at what that is because I don't know it off the top of my head. Domain A was great, couldn't quite tell for domain B. Oh, domain C was awful, whatever that is. D, we couldn't tell. E, not great. F, great. And G, can't tell. All right, so you got your traffic lights there. That's what the risk of bias means. All right. The other thing I really want to orient you to with a forest plot is see that very large vertical line. That really large vertical line that goes all the way down there, right? Now that vertical line means that it's about the line represents the no difference line, right? There's two ways that down here, there's two things it can be. Let me have a look at my cursor's got. See this one here I've circled in red? It says 0, right? Now, the reason it says 0 here, and it's the line of no difference, right? That's what that means. The reason it says 0 is this is what's called a mean difference. Okay, so they've had a look at the mean difference between two groups. Now, if you've got two numbers, a difference means a subtraction, right? That's it. The difference means a subtraction. If you've got two numbers that are the same, and you subtract one from the other, and they're the same because there's no difference, the answer is going to be 0, right? So your line of no difference down here for a mean difference, she says, finding her cursor, is 0, right? Some forest plots are about ratios, right? Now, ratio, it's fine, but a ratio, if there's no difference between two numbers, a ratio is a division. And if there's no difference between two numbers, then the line of no effect is going to be 1, right? So if a mean difference is there's 5 minus 5, and there's no difference, the answer is 0. 5 divided by 5, no difference, the answer is 1, right? So that's all that means. That's a line of no difference, and it can either be 0 or 1. 0 for mean differences, 1 for ratios, right? Anything that crosses that line is not significant. Let's have a look. All right. Forest plots do it graphically and numerically, right? Two ways to show you. Those who like pictures and those who like numbers, but it's the same thing, right? So let's have a look at here. Up here in the Burgess study, it shows me that their mean difference, standardized mean difference between telehealth and face-to-face therapy is that green dot there. That green dot is called a point estimate, right? We think it's there. We think that's the number, right? And if you look over here, that number is 0.03, right? So 0.03, if you look over, graphically, it shows you it's there, right? Those numbers in brackets next to 0.03 are called confidence intervals, right? Now, we can really never be sure that that point estimate is exactly true, right? It's an estimate. We think it's there. So you have confidence intervals that wrap around it, right? We feel pretty confident that the number is between minus 0.48 and 0.55. Yes, it is available, right? So the confidence interval goes from, we're confident that that real number lies somewhere in minus 0.48 to 0.55, right? Scooch across over here, and that's what those lines mean, right? So the green dot is represented by, is the representation of 0.03. but the horizontal lines coming out of it are represented by those confidence intervals numbers. So the end of the left-hand line is minus 0.48, and the end of the right-hand line is minus 0.55, right? So we're confident that the number lies somewhere between those two things, okay? What this also tells me that that particular study, Burgess study, when they were looking at comparing psychotherapy, telehealth to face-to-face, it says that that is not statistically significant. It crosses that vertical line. If it crosses that vertical line, it is not statistically significant. So Burgess found no difference either face-to-face or telehealth. But this is a systematic review. We need to know more than what Burgess tells us. So what do we need to know else? You need to know what the diamonds are, right? So the diamonds are the pooled estimates, right? That means it's taken all those green dots and pooled them, and it's become a diamond now. And the center of that diamond is the pooled estimate. Scooch over to your left to the underline numbers, and the center of that diamond is 0.05. That's what that number says. The horizontal points of the diamond are the confidence intervals, right? So it shows me that the lower point of the diamond, the horizontal point, the left-hand point, is minus 0.17. The right-hand point is plus 0.27. So the diamond pools all of those green dots together, all of those studies, Burgess, Comer, Day, Himley, McAndrew, Watson, and G. They've pooled them all together, and that is the effect size for immediate after treatment, right, for this face-to-face versus telehealth. And because the diamond crosses the line, we can say that all of the studies that have looked at telehealth versus face-to-face interventions for less common mental health problems appear to be equivalent. There's no difference between the two. All right? But what we also want to know is, I'll throw in a little whammy for you. Let's have a look at the risk of bias, right? So the risk of bias over here is there for a reason, right? Remember how I told you that if you don't appraise a study and know what goes in, you can't compare, you're comparing studies aren't done well to studies that are done well, all right? Over here is the weight, right? The weight means how much did each of those individual studies contribute to the pooled diamond, to the big diamond down the bottom, right? And that's important, right? Because you can see that Burgess here, he contributed 17.6% of that pooled diamond. Well, that's not bad. You can see here the biggest contributor was Watson, and he contributed 23.4. Now that's important, because what if I found out that even though Watson here looks relatively okay, what if Watson here had all red? So we put Watson in there, but it was an awful study. It had a really high risk of bias. It was all totally red, but it contributed to the pooled effect the most. You need to know that, because that means he's pulling the number diamond to a place that's probably not right, because it's a bad study, right? So that's why when you think about appraising studies and putting only good quality studies in, you really need to think about, what is it doing to the pooled estimate? In what way is it influencing the outcome of your data? That's why we want to be very clear that we're only trying to include those studies that are good. Or if we can't, we at least show you pictorially which studies are important. And the weight will tell you how much they influence that pooled diamond. So bottom line is, that's how to interpret a forest plot. And I know it's a lot to take in. And this recording is available on the TARC website the minute I can get it up there after today. But what can I tell from a forest plot, right? So I can tell from this forest plot about symptom severity in telehealth versus face-to-face psychotherapy for less common mental health conditions. I can tell that there is no difference in outcomes of severity between telehealth and face-to-face immediately after treatment. There is no difference at 3 to 4 months after treatment. There is no difference at 6 months after treatment, and there is no difference at 12 months after treatment. I can tell that. Those diamonds and show me that, right? I can tell that. But what it can't tell me, and what is important clinical information is it can't tell me, let's go with the top group, the top diamond here, the standardized mean difference in that pooled effect is 0.05. The mean difference between those two groups is 0.05. What it can't tell me is that clinically important? It's so small, it's likely not. And that's fine for this answer. But you have to think about the forest plot gives you a summary about numbers, right? But you have to add in your clinical acumen. You have to bring in your clinical knowledge and think about, is that an important difference or is that not an important difference? And a forest plot will never tell you that. They will just tell you statistics, not clinical importance. So that's the end of critical appraisal for a systematic review using faith and orientating you towards a forest plot, okay, giving you interpretation kind of advice for a forest plot. So now I'm going to ask you, what are the things that I need to be more clear about? What are the questions that you have for me? I'm going to stop sharing, put on your cameras, talk to me, put your hands up so that I can understand what do you need from me to make this a little bit more clear, other than watch it on slow speed several times. What do you need from me? Give us your cameras. Come on, you can do it. Thank you, Belinda. Nice to see you. Thank you, Alice. Doris has always been here. She's been my mate the whole time. Thanks, Doris. That was fun, Anne-Marie. Oh, nice. I like that. I'm not sure it was that much fun, but thank you anyway. What are your questions for me? What do I need to explain better? Who's not shy? Oh, yes, Belinda, am I pronouncing it correctly?
Yeah, that's right. Thank you. It's not what you haven't explained well enough. I just, like, when these articles are published, they have to publish as per the journal's requirements. And if you're checking a peer-reviewed journal, I had always assumed that they would all be quality studies. Do you know what I mean?
Mm-hmm.
That's not the case.
No, that's not the case. Okay. No, that's not the case. I mean, they try to be. There's good intentions, but reviewers sometimes don't have the skill set to appraise, or they're not picking up on the right things. They try to be, but it is a myth that everything published is good. You need to make that assessment and just think about how to do that carefully and with consideration. But even I've looked at articles in the really top tier health journals, and they are not always done well.
Thank you.
Sorry about that.
Thank you.
Well, I'm a researcher and I can say that, and that's awful. I apologize. Any other questions for me? It was a good question. Tanmay.
Hi, that was a very interesting session. I think I'm not sure of. I'm not a statistician, but I wanted to ask you how to interpret the diamond shape thing which comes up in the line. So, is the points of the diamond, if they are towards a control study or towards one of the studies, does it mean that these one? Yes.
Yep. The diamond here is the pooled estimate of all of the green dots, right? And it is statistically done. So if you try to do this by hand, you're not going to get it right. It's literally conducting a meta-analysis is you put the right information into a computer program, and the computer program will do this, right? I'm sure incredibly brilliant statisticians can do this by themselves, but I'm not one of them. So I would put it into a program. But the diamond is it means that all this group of studies, okay, so that's 2, 4, 6, 7 in the top group. This is the pooled effect of those 7 studies, right? So the middle of that diamond, which you can't really see in diamonds, but if you look to the numbers on the left-hand side, the middle is 0.05, right? That's the middle of that diamond. And the 2 outer edges, the horizontal outer edges, the diamond points horizontally, are those 2 confidence intervals. So it's that green dot and the sticks represented in a diamond because it's the pool of all those green dots and sticks. And that's why it's called forest plots, kind of pretending to be trees.
Okay, so does it mean that in the first the smaller diamond, the findings are inclined towards it favors the face-to-face?
Yes, you're right. The point estimate favors face-to-face for psychotherapy, but because it crosses that vertical line, that means that it is not statistically significant. So even though the point estimate favors that, overall, it is not statistically significant. It is not enough difference, which is good news for telehealth versus face-to-face if you're a proponent of telehealth, right? It means it's the same. In this case, it's not significant, meaning they're both equivalent.
And then same with the other at 6 months after treatment and 12 months after treatment.
Right. Okay. Anything that crosses that horizontal line, that vertical line, I beg your pardon, that vertical line of no effect is not statistically significant.
Okay, great.
That's why the picture's really cool. It's once you know it, easy to spot it.
And I love the way they have presented the findings. Are these very similar to most of the meta-analysis, or this is the way we should present it?
This is the way you should present it, and these are my mates. So yeah, you need to present it like this. I picked these because I know these guys and I know that they do it well. Shannon, yes, mate.
Oh, hi. I've just got a question in the chat. How can you be sure the mean generated in different papers using the same methods and the population are comparable?
Well, what you would do is that you would actually appraise all of those included studies. So those 7 in the top tier, the Burgess, Kuma, whatever. You would have appraised those. You would definitely have had a look at, if you're appraising these will be randomized controlled trials. If you're appraising a randomized controlled trial, your appraisal for that would have a look at how did they compare the groups. You would also want to look at what was the outcome. So you only compare apples with apples. What was the actual question? Say it again, Shannon. Did I answer it?
How to be sure the mean generated in different papers using the same methods and the population are comparable.
Okay, if they're the same population, the same methods, and they've done their statistical analysis correctly, then they should be relatively comparable. But yes, you would have to appraise it and have a look. At some point in time, unless you get their raw data, and I don't recommend you do that, but unless you get their raw data, you are going to have to trust that it's done well. Law. Oh, I beg, yeah, law first and then somebody else.
Yeah, thank you for that. That was awesome. With a systematic review that was maybe more qualitative, where it wasn't randomized controlled trials that were included, in the forest plot there, obviously it had a column for weight, where you had decided that, you know, some papers were better quality than others and therefore impacted the percentage of weight that you provided. How would you do that in a more narrative way for qualitative studies?
Okay, yeah. I was a little bit unclear about that. Thank you. The weight is not dependent on the risk of bias. The weight is calculated by things called like sample size and other statistical things that go around in it. So my point was to show you how weight influenced the pooled diamond, and you could perhaps unpack it using the risk of bias. But forest plots do not happen in qualitative systematic reviews at all, right? So in qualitative systematic reviews, there's a totally different way to critically appraise the systematic reviews, although no, faith would work, but you would think about how to total that up. So you would need to have qualitative experience about whether or not the studies looked at thematic analysis or content analysis. How were they done? Were they done well? Were independent people approach? So the same principles equate to qualitative analysis, but how you total that up is going to be narrative. All of the principles apply, but weight, you can't assess weight in a qualitative analysis. You can't. You can have a look at whether or not it was appraised well, but weight won't help you. And also it doesn't affect the pooled diamond because there isn't one.
Yeah, so it would just be about looking whether they've described that well enough.
Yeah. CASP does some really nice stuff in qualitative work. The CASP tool sheet that I had up before, that does some nice qual stuff. But Faith will work. It's just that, yeah. Is it Una?
Yep, can you hear me?
I can.
Yep, thank you for that. I'm just writing a literature review, and at the moment I'm thinking meta-analysis, and if not, like I'm thinking just a systematic review. Do I need to include the biased, the quality stuff in a systematic review as well? Would it?
Do you mean the risk of bias table? Okay, so if you are doing a systematic review, then mostly yes, if you want to get it published, you will need to do a risk of bias. Whatever your research question is, whether it's things like intervention, diagnosis, prognosis, risk etiology, or phenomena experiential, and something else I've forgotten, whether or not it's one of those will depend on your included studies, right? Because your included studies have to be the types of studies that answer those specific research questions. And then you will have to use a critical appraisal tool designed to look at those particular studies. So the Cochrane risk of bias tool that was used in the study I showed you today is specifically about randomized controlled trials. If you were going to do a systematic review or even a scoping review on a different type of study design, then there will be a different type. So if you're doing a prevalence systematic review, you would look at critical appraisal like a HOI, all right? So the HOI paper would be a critical appraisal. All of these things are outlined for you. CASP, again, does a nice thing if you're doing it as a clinician. If you're doing it as a researcher, then I would direct you to a website called the Equator Network, right? That website gives you lots of protocol templates, critical appraisal tools, things to look at for that. But it is a bit difficult.
What is it called again? Sorry.
Equator, as in the line in the middle of the earth, network.
Okay. And what would you recommend for a clinician? Because I'm writing as a clinician.
If you want to publish it, you can't think like a clinician. Faith's not going to work. There will be no articles in the world that go, Faith, I've used Faith. Nah, this is a pragmatic one, right? If you want to look at, thank you, Jenna. If you want to look at a publication, if you want to publish, you're going to have to use one of the published articles. This was about being a pragmatic clinician, what it might mean. Happy to talk offline, Una, if that's helpful to you. You're embarking on a very large task.
Thank you.
And it's fun, right? Are there any other questions? We've got 2 minutes to go. Oh, Jenna, yes.
It's just more of a comment, Rae. I just really appreciate the way that you explain the forest plots. I think that's the best explanation I've heard so far. So thank you so much for that. That was really useful.
You're welcome. You're welcome. I like them, but it took a long time to figure them out. That's nice. I'm sorry, Pari, I can't read the chat. It'd be great if you could include the useful links in the email with the recording. I will put the useful links somehow and you will find it, but you will get the recording when you look on the TARC YouTube website. No worries. Good idea though. I put some links in, but I didn't use the Equator Network. Good idea. Any other last minute questions, guys? No worries. Thanks, guys. Nice to see you all. Looking forward to figuring out where you're all from. Have a nice afternoon. Bye.
Thank you.
Bye. Thank you.